Did you know erectile dysfunction after 50 isn't just about getting older? Many men assume it's simply part of aging or a little bit of stress, but the truth is far more serious. Erectile dysfunction is often a silent alarm, your body's way of warning you that something deeper is going on beneath the surface. It could be clogged blood vessels pointing toward heart disease, high blood sugar signaling diabetes, imbalanced hormones like low testosterone, or even early warning signs of prostate problems. Ignoring it doesn't just risk your confidence in the bedroom, it can risk your long-term health and even your life. That's why experts call ED the check engine light for men's health. When it shows up, it's not something to hide or delay. It's a message you need to listen to, and the sooner you act, the better your chances of protecting your future. When most men hear the words erectile dysfunction, they immediately think it's only about performance or ability in the bedroom. But the truth is much deeper. Erectile dysfunction is not just a condition of male function. It's closely tied to the health of your blood vessels, your nervous system, and your hormones. In fact, doctors often describe ED as the body's warning signal, because the same small blood vessels in the penis are often the first to show problems that later affect the heart or brain. For example, heart disease is one of the most common underlying causes. When arteries become narrowed or hardened, blood flow decreases, not just to the heart, but also to the penis. That's why ED can appear years before chest pain or a heart attack. Diabetes is another major factor, because high blood sugar damages both nerves and blood vessels, making it difficult to achieve or maintain an erection. Then there's low testosterone, which not only reduces sexual desire, but also affects energy, mood, and overall vitality. And finally, prostate issues, whether it's benign enlargement or cancer, can interfere with normal sexual function and signal deeper urological problems. That's why experts say ED is often the first visible symptom of these hidden conditions. Instead of seeing it as just an embarrassing problem, it should be recognized as an opportunity, an early clue that allows you to protect not only your sexual health, but your overall well-being. When men over 50 first experience erectile dysfunction, many go to a general doctor, and that's a good first step. A general practitioner can do a basic checkup, review your medications, and perhaps prescribe a pill to help with erections. But here's the problem. That approach often focuses only on the surface, treating the symptom, not the cause. A urologist, on the other hand, is a specialist. They are trained specifically in male health, prostate care, hormone balance, and the blood vessels and nerves that control sexual function. That deeper expertise makes all the difference. When you see a urologist, they don't just ask a few quick questions. They can run hormone testing to check your testosterone and other hormone levels. They can perform a prostate exam to detect enlargement or even early signs of prostate cancer. They can use an ultrasound blood flow test to see if circulation to the penis is being blocked by clogged arteries. These are the kinds of tests a general doctor usually doesn't do. And when it comes to treatment, a urologist doesn't rely on a one-size-fits-all pill. Instead, they create a personalized plan. It might involve medication, hormone replacement therapy, lifestyle changes like diet and exercise, or in some cases, advanced procedures or surgery. The goal isn't just a temporary boost, it's restoring your health from the inside out. That's why experts say a urologist doesn't just treat the symptom. They find the root cause and create a plan that restores both your health and your confidence. For men over 50, that difference can be life-changing. Seeing a urologist isn't just about better performance. It's about protecting your long-term health and your future. So what exactly are the real benefits of seeing a urologist when you're dealing with erectile dysfunction after 50? The truth is, the benefits go far beyond the bedroom. First, you are actually protecting your heart. Because ED is so closely linked to blood flow, a urologist can detect early signs of heart disease years before a heart attack or stroke might occur. That makes treatment not only about performance, but also about survival. Second, you can prevent diabetes complications. High blood sugar silently damages blood vessels and nerves, but many men don't realize it until ED shows up. With the right testing and advice, a urologist can guide you in controlling blood sugar, protecting your sexual health and your overall health at the same time. Third, it's about balancing hormones. Low testosterone doesn't just lower sex drive. It saps your energy, disrupts your sleep, and even affects mood and muscle strength. By restoring balance, you can regain vitality and a greater sense of well-being. Fourth, it's about prostate health. A simple exam could detect enlargement or even early signs of prostate cancer conditions that are highly treatable if caught early. And finally, it's about a better quality of life. When you see a urologist, you're not only improving your confidence in intimacy, you're also improving your overall health, energy, and peace of mind. That's why experts remind us, when you treat ED with a urologist, you're not just treating a problem, you're investing in your future health. Men over 50, listen closely. If you're struggling with erectile dysfunction, don't brush it aside. Don't convince yourself it's just aging. And don't waste time chasing quick fixes online that only mask the problem. And most importantly, don't let embarrassment silence you. ED is not a weakness. It's your body's way of sending a message, a signal that something deeper may be happening. A urologist is the one who can decode that message. They have the tools, the training, and the experience to uncover what's really going on, whether it's your heart, your blood sugar, your hormones, or your prostate. They don't just give you a pill and send you home. They look for the root cause, and they help you protect not only your confidence, but your long-term health and your life. So the next step is simple, and it's in your hands. Pick up the phone, make an appointment with a urologist, get checked, get answers, and take back control of your health today. Because the sooner you act, the sooner you protect your future. And remember this, you're not just fighting for better performance, you're fighting for more years of energy, strength, and life with the people you love.